Good morning, everyone. Thank you so much for joining our webinar on COVID-19 and planetary health. I'm Melissa Stevens, and I'm the Executive Director of the Center for Strategic Philanthropy at the Milken Institute. Today's conversation is actually the grand finale of the Milken Institute webinar series on COVID-19, where we've looked at a number of different aspects of the pandemic and brought together diverse leaders to talk about diverse, creative, and shared solutions. So today we're going to talk about prevention, and it was Benjamin Franklin who's credited with saying that an ounce of prevention is worth a pound of cure. And while we're also working 24/7 on cure at the Milken Institute, we wanted to have a conversation around how we can prevent the next pandemic before it starts. We know that we have doubled our human population since the 1970s. We've put tremendous stress on the planet that is playing out in a number of different ways: in the pandemic, the wildfires, the hurricanes that that we're all experiencing in the here and now. The pandemic has already cost us over 800,000 lives globally. It's expected to cost our global economy trillions of dollars in the coming years. And so this is not only a health emergency, an economic emergency, it's also an environmental emergency. And we need to sound that alarm just as loudly. At the Center for Strategic Philanthropy, we know that philanthropic capital is part of the solution, but it's not the only solution, that we need a multi-sector, multidisciplinary, systems-based approach that really allows people and planet to thrive together. We have an amazing lineup of speakers today to talk us through how we got here, and what are we going to do about it, essentially. So first we have Simone Friedman, who is the head of philanthropy and impact investing at EJF Philanthropies, and she has made a number of high impact investments and led initiatives in the conservation and environmental space. We have Eric Good, who's a conservationist, a founder of the Turtle Conservancy. He's worked with a number of leading NGOs and is a filmmaker and director of a little known docuseries that you might have heard of called Tiger King. We have Dr. Mark Smolinski, who is our resident infectious disease and pandemic expert for the next 60 minutes. And he's president of Ending Pandemics, which is a nonprofit that brings scientific and technical expertise to bear to help us find outbreaks even faster. And last, but certainly not least, we have Dr. Gunhild Stordalen, who is the founder and executive chair of EAT, which is a nonprofit, a global nonprofit that is really trying to transform our global food systems through science, inpatient disruption, and novel partnerships. So I'm going to be asking a lot of the questions, but not all of the questions. So we ask you to submit your questions from the audience through our Q&A button at the bottom of your screen. We're going to be curating those, and we're going to get to as many as we can at the end, towards the end of our hour. So in the spirit of Gunhild's inpatient disruption, let's get started. And I want to first turn to Mark. So Mark, global disease emergence is really linked to human-induced drivers in more biodiverse portions of the world. Tell us how we created the conditions for this zoonotic disease, and why is this pandemic, why is COVID-19 different than what we've seen from other zoonotic diseases, SARS, MERS, hantavirus, which you helped to discover? How did we get here? And Mark, can you unmute yourself? Great.
Yeah, thank you for this opportunity. It's great to be on this panel. So we got here in a lot of different ways. It's probably easier to answer your last question. What is different about this? What's the same about this is every disease that has epidemic or pandemic potential, 3 out of 4 of those jump from animals to humans. So that's what's been common amongst all of the list of other pathogens that you mentioned, including hantavirus, MERS, SARS, and certainly HIV is a grand example of a zoonotic disease, meaning it jumped from animals to humans, that has become probably the greatest pandemic that we're still dealing with today. So all of the different factors that come together, which is land use, climate change, political will, human behavior, travel and trade, there's a whole slew of factors that are the reasons we see diseases emerge. And we've worked with the EcoHealth Alliance and conduct a lot of our work based on a hotspot map that generally indicates where all of these factors have come together in various parts of the globe to indicate diseases are likely to emerge from those areas. And certainly coronavirus has been no exception in emerging from one of the hotspots in Southeast Asia. So all of these things come together. We've been working across the globe with countries to really take a One Health approach and thinking about all the environmental impacts, the animal health and the human health as one ecosystem, and thinking differently about how we look at our environment and the impact of humans and the animals so that we can find outbreaks faster. Because that's ultimately what we need to be doing, is the prevention efforts that are hard to get people to rally around because low probability event of a pandemic, but a high consequence, as we now all see, is a really hard case to sell when there are so many things that impact everybody's health and other issues for governments to deal with on a day-to-day basis. So really, the inability to look at long-term approaches that are really necessary, as you mentioned, for systemic change, for us to deal with the fact that we're all in it together, humans, animals, and the environment, and that's what we need to focus on if we really want to get ahead of preventing epidemics that then can become a pandemic like coronavirus.
Great, thanks, Mark. And we definitely wanted to dig into that change in mindset throughout this conversation. Eric, I want to go to you next and invite your thoughts on this. You've been part of protecting wildlife and wild lands for some time. You've investigated or studying animal trade and exploitation. What have you learned about the human-animal-wildlife interactions that continue to put us at risk for future pandemics?
Okay, well, you touched on it, obviously, the population growth that we've experienced. Even in my lifetime, the population has tripled since I was born. There was 2.5 billion people on planet Earth when I was born. Today, there's almost 8 billion. That, coupled with the newfound wealth, just globally, has created a perfect storm where just the pressure on wildlife is immense. And so I spent much of my time surveying markets around the world in South America, Madagascar, and particularly Southeast Asia. And what you're seeing in wildlife markets, when I say wildlife markets, I'm talking about bushmeat markets, wildlife markets for the pet trade, all the wildlife markets. You see that people have to go further and further to find the wildlife that they used to be able to find in the regions where these markets were. So for the example of China, you have to go all the way to Africa to find pangolins these days, or even in local regions, Sulawesi, where I've done a lot of surveys of markets, they have to go now 200 miles away in Sulawesi to find monkeys and pythons and fruit bats where they used to be able to find them locally. So you're seeing that these markets are taking animals from further and further away, and that supply chain stresses them out, and the toll is on these animals, and the shedding of pathogens and everything that's happening is worse than it ever was. And so anyway, yeah, I've surveyed markets all over the world, and particularly Asia, and it's shocking, it's barbaric. I think it's hard for people to even imagine how barbaric they are until they see them. Mm-hmm. And you would ask, how is a guy from Tiger King on a panel like this? But my exploration into film started exploring that world.
Yep. Well, we're going to come back to that. I want to put another big issue on the table. Gunhild, let's talk about food. Food is where healthy humans, healthy planet really intersect. We're trying to feed nearly 8 billion people, but we're depleting the planet while we're doing it. Why is food an integral part of this conversation? And tell us about the connections between COVID and our collective food systems.
Yeah, thank you. I mean, there are so many connections between the pandemic and our food system. And first of all, I mean, COVID has laid bare how vulnerable and how fragile, inequitable, and also non-resilient our food systems are. And it has also shown the enormous risks and costs of the pandemics in the world we have created since really the dawn of the Industrial Revolution, with humankind becoming the all-dominant species. And in this new geophysical area, which we call the Anthropocene, we are now basically manipulating the entire biosphere. And nothing else we do comes close to have food and food production are causing environmental harm. And on the other hand, our food has also become the #1 risk factor for disease and premature mortality in the world, and now killing more people than alcohol, tobacco, drugs, and unsafe sex combined. So around 11 million people are dying every year due to poor diets. And in the context of this epidemic, our food systems are actually both a contributing cause and is also an amplifier of its impact. It's a cause, as Mark mentioned, COVID is a virus spillover from wildlife, associated not only with food trade, but food production. And we know that agriculture is the #1 driver of ecosystems degradation and habitat loss, which increases the risks of virus spillover. And food is also a major source of greenhouse gas emissions, and climate change make this worse. And like we have seen in the past with bird flu and swine flu, factory farming in particular is also a breeding ground for zoonotic diseases. And food is an amplifier of the impact of the epidemic. We know that the widespread malnutrition, just saying 1 out of 3 people on the planet today is malnourished. That makes us more vulnerable to all kinds of viruses, and obesity and diseases associated with unhealthy food is shown to increase the mortality of COVID. Indeed, it was a paper today showing that obesity increases mortality by as much as 50%, which is shocking. So in short, modern food production and consumption are really undermining the main shields protecting us from harm, which is healthy ecosystems and healthy diets. So unless we transform and fix our food systems, we will not only continue to push Earth well beyond the planetary boundaries, but also we are doomed to suffer new pandemics, potentially even more lethal and even more costly than COVID-19.
Okay, great. Well, so we've laid the groundwork for the problem. So now, yeah, let's talk about fixing it. How do we fix it? So Simone, I want to turn to you. As a philanthropist, an impact investor, change maker extraordinaire, when the pandemic hit and you thought, what could you do? You didn't look at managing the symptoms. You looked at what were the root causes, and how do I affect the root causes and prevent future pandemics? So tell us a bit about your decision to do that and the work that you're doing with your philanthropy around the End the Trade campaign.
Sure, thank you, Melissa. So around the beginning of March, middle of March, I was self-isolating here in Washington, D.C., where I live in my apartment, and I had a lot of time to think. And I've been traveling for 2 years straight, and I was thinking about really what is it that we've been funding over the last several years that has an impact, that we can prevent the world from going through something like this before. And I realized that we've been very big funders in trying to fight the illegal wildlife trade. In particular, we've been one of the largest funders in the world of trying to stop the trafficking of pangolins. And actually, when I learned that there was a relationship between the coronavirus that pangolins had and the human coronavirus, and that even though the evolutionary pathway is not 100% confirmed, that we do know that the receptor binding domain on the spike protein in the pangolin coronavirus did make its way into the human coronavirus. I thought to myself, oh my gosh, we have not been doing a good enough job at my family in terms of funding that we could be doing. We've been trying to stop pangolin trafficking, but had we done more, had other philanthropists done more, had the world come together to do more, this particular COVID-19 pandemic may not necessarily be as bad, and it may not even have happened. And so what I decided to do was mobilize a coalition of philanthropists, nonprofits, individuals, policymakers, as many people as possible to try to end the trade, not just in pangolins, but really in any terrestrial wild animal which potentially creates a zoonotic disease risk. And so I contacted a group that I'm involved with called Global Wildlife Conservation, which Eric has been involved in as well, and as well as WildAid, as well as a group called Wildlife Conservation Society. We came together, we created a declaration to end the trade with a set of principles. We enlisted the help of Leo DiCaprio and several other high-profile individuals. And we launched a campaign. And as a result of that, right now, we have over 377 organizations which have signed on. Over 83,000 people have signed a declaration. And most importantly, I mean, there are three main strategies that this initiative is taking on in order to actually stop the trade. Number one, reducing consumer demand for wild animals that potentially carry zoonotic disease risks. Number two, cutting off supply chains in terms of law enforcement. And number three, monitoring for pathogens. And I think that all those three different pillars, those different strategies are what's needed to prevent something like this from happening again. And what my next step after this, and I've been working on, is actually then taking this, mobilizing this coalition, activating it to then actually support policy change, which is happening right now. And so I can talk about that now or wait until later, whatever you want.
Yeah, you can. Why don't you share a little bit about that now, Simone?
So I've been working behind the scenes with Senator Cory Booker as a Democrat in New Jersey, as well as the office of Senator John Cornyn as a Republican in Texas, on bipartisan legislation that will be introduced after the recess in the U.S. Senate. That it's a bill called Stop Future Pandemics. And what it does is it's absolutely a game changer if this can actually get implemented and funded. That it provides funding for all of those three pillars that I mentioned before. So for the demand reduction campaigns, for law enforcement, and for monitoring for pathogens. And literally this bill will make a huge difference in reducing the risk of another pandemic, because we're having a situation where this whole situation could have been prevented. That's what's so crazy about what's going on right now, is that had we taken the right steps as a world and as a society, we did not have to go through this. And this bill, if it can get passed, this will make a big difference. And so for everybody on the webinar, if there's one takeaway that I have, is to support this bill. So you can do that by going to the endthetrade.com, or you can contact me separately if you have relationships with senators. But we've got to get this thing passed. It's absolutely critical.
And we talk about policy as the ultimate lever in solutions. So Gunhild, I want to turn to go back to you, because at EAT you've put together several different collaborative solutions, and you've thought about policy as well. So policy change from land use, ecosystem preservation to food labeling. Tell us about what your calls to action are for policymakers and also for consumers.
Well, I mean, governments really need to step up and do what they are supposed to do, namely govern for the sake of the common good. So this means adjusting and aligning their policies and regulations and other public sector instruments across the value chain and towards common objectives across health and environment and socioeconomic. And this should and must, of course, be anchored in the best available science and also accounting for all the externalities of food. And on the production side, there are two things in particular that must happen. The first is that expansion of agriculture and other extractive activities into natural ecosystems. It simply has to stop. So that time is over, and we need now something like a global treaty to stop further expansion and also exploitation of oceans, and governments must put in place the financial mechanisms to enable that. And secondly, we need also to put in place policy frameworks and incentives to drive a massive shift to regenerative, carbon absorbing production of healthy and nutritious foods. And one example, which should be a low-hanging fruit, is to repurposing the around $700 billion in agricultural subsidies, which mainly goes today to support the production of what is making us sick and destroying our planet. And on the demand side, there is a whole toolbox of instruments that can be used to make healthy food affordable and available for everyone, which is not the case today. And that goes from tax and subsidy reform to public procurement rules, and from preventive healthcare reforms to purpose-driven public investment in innovation. And one particular thing is marketing of health-damaging foods to children, which really should not be tolerated anymore, because that is frankly a violation of their human rights. And finally, on people, I mean, people as voters, as citizens and consumers, they have obviously a big role to play. But for this to happen, people must have access to the knowledge and the tools they need to demand change from policymakers and business, and of course to be able to make better everyday food choices. So that means we need new nutritional guidelines that consider both health and sustainability. We need improved food labeling and digital tools like apps that make it easier for people to know where the food products come from, how they are produced, and obviously their nutritional value. But perhaps most important, we need to involve people directly and give them an opportunity to take part in the great important conversation we need to have about the future of food. And obviously everyone is a stakeholder of the food system, unless, I mean, if nothing else, you eat. So we need to connect to this daily drumbeat and offer people the chance to participate in shaping our common food future.
Yeah, and we can't implement solutions if we don't understand the problem and we don't understand the solutions. And so we need to move hearts and minds, and media and storytelling can be a powerful tool for doing that, to create both a bottoms-up movement and a top-down response. So Eric, I want to turn to you. You know, storytelling's been around for thousands of years. In the caves, we had cave dwellers that told stories of encounters with mammoths and lions and rhinos, and it's even a more powerful tool today given the accessibility and the distribution. Tiger King. Sorry, I watched Lion King with my 4-year-old son last week. Tiger King reached 34 million people in the first 10 days. So how do we really leverage the power of story now to help people understand and to mobilize them and for solutions to gain traction and momentum?
Well, I got a bit lucky with the pandemic and the timing of the Tiger King, but I think that, yes, of course, the power of the media and storytelling is an incredibly powerful tool. And in fact, we're doing just that right now, looking into, our relationship with animals, and we're doing a story on that right now. We'll see where it lands. And it's really where the Tiger King began, as I said earlier. And hopefully, we can tell the story in a way where we can cast a really wide net and not just preach to the converted, but preach to the unconverted. So I think the goal in storytelling is to tell stories in a way that are not maybe so much the way we used to tell stories, and not make them preachy or the voice of God or heavy narration, but really try to get this out to a very wide audience and really reach a lot of people to make change and make a difference. And we're criticized sometimes for, maybe people think we're exploitive or we're doing this or that, but the truth is the goal is to reach the widest audience to make change. And I think there's tremendous power in that. And so that's what I do largely at this point right now, but I also do land preservation, which is another thing that we do on a smaller scale, which I just want to emphasize because I think that's at the core of what's going on here, is that we have to protect wild lands for every reason, for selfish reasons and for biodiversity, fresh water, clean air, the species we love. And there are many people doing it both in the private sector and elsewhere. And I would highlight the people in the private sector because I really think everyone can take part in this. And there are people that have more resources than others, Ted Turner, Doug Tompkins of Tompkins Conservation. But if everyone took their part, that's a tremendous way to solve this problem.
Yeah, great. Thanks, Eric. Mark, let's turn to you. We've put a lot on the table here. I know you can also speak about the power of storytelling. You were part of putting together the blockbuster hit Contagion, which had a terrifyingly accurate portrayal of what a pandemic might look like. How did that help to raise awareness and really garner momentum for the work you're doing? And would also love your thoughts on some of the proposals and policy solutions that have been put out, because I know you were thinking about this 24/7 around how do we undo this, how do we prevent the next one before it starts?
Sure, thank you. Yeah, in 2009, we all did live through a pandemic. Many of us did not realize it because it was swine flu or H1N1, and people most likely thought it was just a normal flu season, but it truly was a pandemic strain and probably impacted a few billion people across the globe. It certainly did not have the lethality or the virality that we would expect as we're seeing with something like a novel infection like coronavirus. So Contagion was made by Jeff Skoll's film company, Participant Media, in conjunction with the Skoll Global Threats Fund, where I worked at the time, to really increase awareness about what would a pandemic look like that would have devastating social, economic, and physical manifestations like we're seeing with coronavirus. So that was the reason of making Contagion back in 2011, and certainly a lot of those scenes from the movie are playing out in real life. For us, and listening to some of the other conversations, and especially your comment about policy being the ultimate lever, while that may be true for many things, and we certainly do see the impact of policy in moving forward some of the elements like One Health and bringing human and animal and environmental ministries together and other issues does involve some policy. But ultimately, the countries where we've seen the most success are those governments that have engaged their public directly. And so some of the other comments about the role of the population and having a real impact on the particular threats that they're working on, we see as having the biggest impact, not only on preventing epidemics, but really helping us think about forecasting and prediction. But more importantly, by engaging the public directly, we have increased our probability of finding the earliest signs of an outbreak. In many parts of the world, we have engaged the communities that they're identifying outbreaks in animals before we even have a single human case of a zoonotic infection. And even if it's not a zoonosis, meaning it jumps from animals to humans, our system in Chiang Mai, Thailand, for example, a community health worker identified the first case of foot and mouth disease. They were able to vaccinate all the other cattle, and that saved $4 million of exports that would have been banned from their milk for many months into the future. So that had an impact on livelihoods, which ultimately impact on health. More importantly, by us engaging communities directly, we're not only finding outbreaks faster, once they're empowered with tools that have been created by local technologists in partnership with their governments in those countries, they are now using those tools for other things. The same system in Thailand has now reported issues about food safety, the quality of the food that's being brought into their neighborhoods. They're reporting the license plates of people selling counterfeit drugs in their village. They're starting to report areas of stagnant water and pollution. So the point is, if we can empower communities to be, put the public in public health, we can fully advance really learning more about the environment, the animals, and the humans. But more importantly, because that community is engaged, when a threat does get identified, we now have an immediate way to start a response, because communities are in a system that's a two-way communication with their governments and other partners. So we see that as ultimately, the transformational goal of public health is really to engage the public directly, and it will allow us to do many of the other things that the other speakers have talked about once we have an engaged populace.
Great, thanks, Mark. So we've talked about changing consumer behavior, raising awareness, policy as a lever. I want to talk a bit about the financial markets and the corporate players and investors. We have nearly $35 trillion in both the private and public equity markets, and so this also is a lever to pull. Simone, let's start with you. Tell us a little bit about the work that you're doing with your Investor Alliance on zoonotic disease risk, and how you are looking to change investor behavior by redirecting capital flows away from risky activities.
Sure. Before I do that, let me just comment on what Mark just said.
Yeah, great.
I agree, Mark, completely with what you're saying. And I would take it a step further, and that to really touch on this idea of consumer demand. So for example, are the people in the community that you're working with, are they themselves consuming animals, which would potentially carry zoonotic diseases? And so, there are groups on the ground working globally to really engage in consumer demand reduction education campaigns using athletes, artists, very high profile individuals who have a lot of sway, and such as Wild Aid. There's a number of different groups that are doing this. But the consumer demand, even Gunhild, even with food, just the food systems in general, consumers' demand drives supply. And what consumers want, companies will provide. And so it's an attitude issue that we have to deal with. It's not just a reporting issue, but it's the whole sort of demand ecosystem. And so with that framework, what I'm doing on the investor side is I'm partnering with FAIR, with my friend Jeremy Collar Capital, and Farm Animal Investment Risk and Return Initiative that he set up, which is now a coalition of institutional investors with over $23 trillion of assets under management. And what we're doing is we're coming together to highlight the idea of zoonotic disease as an ESG risk for investors. And we'll be launching this initiative in September likely. And with the first blockbuster news, which we will be reporting, that we have identified publicly traded companies that are engaged in the pangolin trade. And this is something that is absolutely unacceptable. They are creating a risk of another zoonotic disease pandemic. They are potentially increasing the risk of COVID worsening itself. And so this is an initiative that we're starting. These publicly traded companies are in some cases widely held, including by investors that you wouldn't realize. And so this is something that we will be announcing, like I said, September, potentially early October, and we'll be inviting. It's just an educational initiative that we're funding ourselves at EJF Philanthropies, and I'm happy to invite whoever is interested to participate in our launch event for that. But we do really believe that there's massive power in investors to engage with companies. We're not trying to advocate divestment. We're trying to advocate working with companies to change what they're doing, to be more responsible to the world, to really as a form of stakeholder capitalism as we move into sort of the next phase of what we need for society.
Great, thanks, Simone. So Gunhild, I wanted to go back to you as well, because you, in your calls to action or in your solutions, you've also thought about the financial markets and the corporate players, and what are you asking of them to put a dent in this problem?
Well, to put it simply, the investors and financial markets must shift investment flows away from unsustainable and unhealthy practices. And the key to unleashing this shift, I think, is that there is already a growing realization, at least in parts of the financial and business community, that narrow, short-sighted profit seeking is no longer a viable strategy for building wealth. And it's simply too risky, and investors are starting to see that. So going forward, the only investments that make sense are really those that actually help us move away from the brink. So, but this is still not, it's still not a real change at scale, although, I mean, examples like FAIR, it is really promising. But we in EAT are now working with partners, and we have set up a food systems economics commission that will provide economic decision makers and investors with the tools and knowledge and evidence to make better decisions. And we are also working now with the World Bank to build a coalition of leaders from both finance ministries and also from the financial sector itself, dedicated to the task of shifting the flow of finance towards a healthy and sustainable and equitable food systems. And I would also like to mention another initiative, which is really interesting, which is the World Benchmarking Alliance, that is now developing publicly available corporate benchmarks to help investors assess the performance of companies against the Sustainable Development Goals. And that is really giving investors no excuse to look the other way.
Great. Mark, do you have thoughts on that?
Yeah, so as far as the corporate partnership, we're finding some really interesting ways to bring in the private sector in the countries where we're working. For example, in Cambodia, the Ministry of Health, in order to engage all 14 million people living in the country, we worked with them with the process where I explained local developers working with their governments to create solutions that work for their populace. Their idea was to come up with a free national hotline, and including the huge illiteracy rate in Cambodia, having it be as simple as a touch command. If you call in with the voice activation to an SMS to a hotline. But in order for that to really work, all the telecom companies in Cambodia collaborated. So that is now a free system, regardless of who your provider is, what phone you have. And that was a really simple ask. When we went around to all the telecom companies, quite frankly, their response was, no one has ever asked us to help for public health. And the amount of help that you need is such a small fraction of what we're doing that we see this as part of, our corporate social responsibility. But it took that, nidus of an outsider, we're sort of a quasi philanthropic NGO kind of group, but we're able to work with the private sector, with governments, with technology partners, and bring those different, bedfellows together, if you will, to create a solution that was a win-win for everybody. So I think there's a great opportunity to bring some of the corporate partners into the solutions, in addition to just, things that are good investments for them. And that's been really exciting to see. From a philanthropic point of view, and all of our funding comes from philanthropy. What we're seeing is it's a great opportunity to really test out new innovative ideas with people who are not afraid of risk capital and not afraid of taking failure. And that's very helpful when you're trying to try something innovative in a country that has very limited resources, to be able to do that with philanthropic dollars. And then if successful, the government can then take a successful approach and move it forward. Also, what's important with philanthropic dollars is the chance to be able to make longer term investments, which are very hard to do often with government dollars that are tied to different cycles and other issues, or short-term funding or research projects. So there's a great opportunity for philanthropy to really help with disease surveillance by helping look at new innovative ways, making longer-term investments, and really bringing different groups of people together as sort of a catalytic group.
Great, thanks, Mark. So first, I want to say, Gunhild, that's exactly the kind of human-animal interaction that we all want to be having right now with your dog. So thank you. And Mark, I feel like we're singing from the same song sheet when we talk about the opportunity for philanthropy as a unique asset class, and that it's high risk. It can fund and de-risk opportunities for government and follow-on investors. It's in it for the long haul. It can be patient capital, and it's collaborative. It can bring together different sectors and non-traditional allies to talk about solutions. So maybe I'll pose one more question, and then I know we have some that have come in from the audience. And Eric, back to you, and picking up on this theme of philanthropy, and that it is such a unique asset class, and you've been involved with a number of NGOs, and with, as you mentioned, the Turner Endangered Species Fund. How do you see how do we scale some of that amazing work, and how do we do more with some of the philanthropic efforts that you've been involved with?
That's a good question. And I should give a shout out to Leonardo DiCaprio, who helped us buy one of the largest tracts of land in Mexico, actually, for conservation. So also organizations like Global Wildlife Conservation and some of the others. And if I could just say one other thing about the power of media, WildAid does an incredible job. And I just got to say, what they've done in getting the little they have and how they've made an impact is incredible. But as far as scaling up philanthropy for these kind of causes, listen, the more the merrier. But what I will say about that is I think it's really important to find projects that ultimately can be sustainable without constantly having to kick in more and more money. And I love models that replace, the core issue here, which is local people on the ground need to survive wherever it is in the world. And they look in their protected areas or not protected areas, and they collect whatever wildlife they can, and they monetize it. And that is where, this chain, starts from, similar to drugs. And I think it's great when you can find something to replace that. And so ecotourism, whether it's models in Kenya or Tanzania or South Africa, there are lots of models. And if we can find programs where we can really understand how to replace, the core problem of collecting wildlife for the trade or whatever it is, and find another solution, another way for these people, local people, to make a living. Those are the programs that I really find the most interesting, where you don't have to continually throw money at a project. And they're not all that way. And so I'm not saying that's the only way, but it's definitely something to think about. And how can we be creative when we're trying to find solutions to this? Because ultimately, it's not just about money. It's about finding solutions to the core problem. It's a socioeconomic problem on the ground.
Yep. Fantastic. Thanks, Eric. So we're going to start taking some questions from the audience. And the first one is anyone can feel free to jump in and answer this, but this is really about equity and how are systemic issues of diversity, equity, and inclusion impacting the prevention of pandemics. Folks have thoughts on that?
Well, in the work that we're doing, we're engaging the entire population in partnerships with their governments to be the eyes and ears and the first responders in looking for threats in the community. And so in that sense, and again, in using the technology that already exists in the country, not bringing in technology that everybody doesn't have access to, allows us to have that approach. So we take a whole population approach in each of these hotspot countries that's inclusive of everybody in that country. And really, technology is an opportunity for us to think about using the technology that already exists, as simple as it might be, because all we're trying to do is move information in two different ways. I mean, it doesn't always have to be a shiny new, brand new app on a smartphone. Again, it could be just giving people the ability to make a phone call and have someone who cares and can respond being on the other end of that. So I think that, is one way to really be thinking about DEI across the work.
And so on my side of things, in some countries where the trade in wild animals is a problem for zoonotic disease, the demand is driven by wealthier people. The consumer demand is coming from restaurants, it's coming from people who are thinking that it's cool or that this is an aspirational idea, for example, to eat a pangolin, and it's not a subsistence issue. And it's more of a commercial trade issue, that this is something that is the suppliers are parts of international criminal organizations in many cases that engage local poachers because of what Eric mentioned about the need for money. And so what we're doing is, like I said, on the obviously if we stop the consumer demand on one side, but then for those individuals who do rely on the trade, the commercial wildlife trade for subsistence living, is try to find alternative livelihoods. And so part of this bill, the Stop Future Pandemics bill, which I've been working on, it will provide funding for that for the United States government to work with other countries, to work with other with NGOs through USAID, to actually provide funding for individuals to find alternative livelihoods if this is something that they need. And the Chinese government has actually been extremely cooperative and really in some ways taking a leadership role, and has been providing some funding for farmers, commercial wildlife farmers, to transition to other types of business lines. And so just one example is there's a province in China where farmers who had previously been raising in a commercial way bamboo rats are being encouraged to transition to planting seeds that actually will grow a special type of oil that can be used for anti-aging ingredients as well as for cooking. So I mean, this is a plant-based oil. So this is just one example of potentially how do you transition farmers outside of the commercial wildlife trade, into something else that actually, has a positive benefit for society.
Great, thanks, Simone. And I'll just add from a philanthropic standpoint that I think those who are funding in this area can take an immediate look at supporting organizations that are led by Indigenous people, minorities, people of color, and can really start a conversation and put together a plan of action for how they can move their philanthropy towards addressing these issues and overcoming equity issues in the environmental space. I want to go to Gunhild next, and first give you a shout out from the audience about some of your comments and a question to dig in a little bit more around how you mentioned a global treaty. How would you imagine the implementation of this global treaty to address the future of food and food production in the face of capital interests? So we'll put that out there. Also, feel free to jump in on the equity question, since that's probably you've been thinking about that as well.
Yeah, that is probably an easier one to start with. So just on the equity piece, I mean, we each started out really addressing health and sustainability, and we have come to realize that without addressing the equity question, there's no chance at all that we will make this transformation happen. And I would just say that all over the world, producers have been losing out decade by decade to other players and smallholder and farm workers especially. And this has to change. So producing healthy foods sustainably has to be rewarded, which is not currently the fact. And it brings more value than just food on the table. I mean, it's health, resilience, etc. And then when it comes to a global treaty, I mean, this is something that is really difficult politically to discuss, but I think here is also an equity dimension and the high income countries that have been driving a lot of the emissions and also being contributing to the demand causing ecosystems destruction, etc. High income countries have to come together and help financing and creating the mechanism to allow low and middle income countries to actually protect their ecosystems hotspots. For example, Borneo and the rainforest in Brazil as an example. So, but the next year there will be a food system summit, which is an historic opportunity to bring the world together around food systems, and this is where obviously something like a framework convention won't be possible, as it will be hosted by the Secretary General, not the member states. But this is the start of a discussion like a global treaty where that could happen. So I'm hopeful, and again, I couldn't agree more with your remarks earlier, Mark, on the power of the consumers, and Bono is putting it spot on. He says that people today have so much more power than the people in power. So this is also some of the things that we have learned over the past years with EAT, that we cannot talk about a top-down transformation. This has to happen bottom-up, and people need to be empowered and being able to demand changes from governments and the finance community and private sector. So again, people is so important in all of this.
Great, thank you, Gunhild. Mark, let's go back to you. You mentioned the concept of One Health, this approach. How can we accelerate that process of adopting One Health? I mean, it's really changing the way we're defining, training, practicing, funding public health. How do we accelerate a movement towards One Health where we're bringing together humans, animals, planet?
Yeah, thank you for that. So we had gone to one too many conference about One Health as a concept to when I started asking people, well, who's doing One Health? What does One Health really mean? And when it was clear that it was more of a concept, and clearly it makes sense theoretically, so we set out to test out the idea of One Health in the community. So I already mentioned our project in Chiang Mai, Thailand, which is our oldest project, but has really set the stage for how we approach One Health in other countries. So again, it really depends on engaging the population, because we have so many silos to break down that have been built up in the human health community and the animal health community. We heard a lot about wildlife, but there's just as many issues with livestock and domestic diseases that have to do with other interactions, and not just wildlife per se, but that is an incredibly important element of it. And then when you start to factor in all the environmental issues, ultimately, the communities themselves are the places to start, because they don't have those silos. They wake up every day and they think about their day, taking care of the animals, getting people to work, food, water, all of those issues. So that for us is the place to start. And if we can empower communities to have simple tools that if there's something that they see, it's like, it reminds me in the US after 9/11, see something, say something. It's like now they're empowered to, report to their village health worker if there's something going on, or the community health workers are taking photographs and sending those in directly to the government. The hotline that I mentioned in Cambodia that's free to everybody, we started that about 4 years ago. They got 600 phone calls on average a day. 20 to 30 of them were true events that either the animal health or the community or the human health had to interact with. When COVID hit Cambodia, that hotline started receiving 15,000 to 20,000 phone calls a day. They had to hire 25 full-time operators, and 90% of all the cases under surveillance in Cambodia were first identified through that hotline. Cambodia still has not one single death from coronavirus and has had, a couple hundred cases. The same thing that, in Vietnam, where they take the One Health approach, and they were very smart, and they have 100 million people and not a single death from coronavirus in Vietnam, even though they've had many cases. So the point is, we can think about implementing One Health at the community level without worrying about all of these silos that are so hard to break down because they don't exist at the community. And slowly we're getting governments to move together and see the data coming out of the communities. And in Cambodia, for example, we're building a dashboard that's going to be shared by the Ministry of Wildlife and Agriculture, as well as by the Human Health. And the hotline is one of the feeds that really drove that kind of collaboration together. So I really think for One Health, it's got to start at the community and work its way up at the top, because what we were just seeing from the top-down approach was more of a philosophical, academic, theoretical exercise. But once you start implementing One Health, the magic really happens. The community shows us, what's possible. And it also gives you a chance to engage, like I said before, strange bedfellows. Not all of the wildlife interaction that leads to zoonosis is just through illegal trade or even, growing or farming of those exotic wildlife. In Tanzania, we're working with the Maasai community because they're the ones who raise their wildlife and move it around every 3 months, and they're in the Serengeti, so their livestock are interacting with wildlife as part of how they're raising their livestock. And we're also looking at, as people are moving more towards changing their practices and doing more in ecotourism, what are we thinking about at the risk of direct transmission to humans when they're going into bat caves, or they're going into areas where they may be coming in contact with exotic wildlife because we've changed how we're allowing humans to interact in different parts of the world. So there's so many different elements, but it all seems to come down to educating the public and letting them understand about zoonotic diseases and empowering them to really take some innovative approaches to reducing the threat.
Great, thanks. Well, and Simone, if I could transition us to our call to action, and you can follow up there. I do want to have an opportunity for everyone to share some parting thoughts with us. Mark, in a piece that you co-authored earlier this year about a wake-up call, you said that the people are wide awake. We just need them not to hit the snooze button this time. So how do we get people not to hit the snooze button? Simone, let's go to you, and you can follow up on Mark's thoughts and add your call to action.
So the One Health approach can be, if it's taken from a policy perspective, which it will be, the Stop Future Pandemics bill makes One Health the official policy and will provide funding for the United States to encourage other countries to adopt a One Health approach and potentially fund groups like the one that you're involved with in Cambodia. And there are so many opportunities in different countries to engage. For example, in Nigeria, WildAid, I was speaking to Peter Knights from WildAid the other day, and he said that there are markets in Lagos right now which are selling pangolins, which are selling monkeys, live pangolins. This is potentially another zoonotic disease pandemic waiting to happen. And there's a huge opportunity to engage with the Nigerian government so they can take a leadership role in really shutting down this those activities that are part of this market and preventing another pandemic. I mean, we have it in our power to prevent another pandemic that's coming from specifically from the wildlife trade. It's obviously harder to deal with the zoonotic disease pandemics from the larger industrial animal agriculture system, which is a huge problem, of course, and from biodiversity loss, which is also a huge problem. But from the wildlife trade perspective, yes, we do have the ability to stop this problem and prevent this from happening again.
Great. Eric, I want to turn to you for your call to action for the group. Philanthropists, investors, consumers, what should we be doing when we get off the webinar?
I would say seize the moment, you know, being a part of this coalition to end the wildlife trade, terrestrial wildlife trade. I would just make 2 points. Just one, really, this is a time to focus on the core problem, which is where this comes from, not the symptoms so much. I mean, we have to do that too, but really understand that this came from wildlife. And also to make the point that this is not, there's not really a distinction about the illegal wildlife trade or the legal wildlife trade. They're both the same ball of wax. They're both bad. And I just can't emphasize that enough. Now, I'm not talking about sustainable, local, subsistence hunting. That's very different. I'm talking about large scale, for the most part, movement of wildlife to other countries for this sort of new, found wealth of eating animals for status, for, for whatever reasons, for sometimes medicinal reasons that are unfounded. But I would just say really focus on where this comes from, which is, the wildlife trade. And this is a moment for us to really seize that moment.
Great. Thank you. Gunhild, let's go to you.
Yeah, so I would end by saying that I think the power of food is not only because it can be the most powerful medicine for people on planet, but it's a connector and it brings together so many agendas and allow us to come together, break down silos, and it's something that affects all of us. So my hope and dream is that between now and the Food Systems Summit next year, we will be able to really fuel the growing movement for change. So how can philanthropy and investors help? I think that is by joining this movement and fund the initiatives and actors that are building it. And as investors, leave the stuff that damage our health and destroys our planet behind and invest in all the innovative solutions that are pointing the way to a better food future for all. And finally, as consumers, we should all remember that the most important decision we are making every day for our own health and the health of the planet is what we put on our plates. And what is that? I think Michael Pollan still is the one that sums it up the best. And he says, eat real food, mostly plants, not too much, and of course, waste none. So thank you.
Great. Mark, final thoughts.
Yeah, well, this has been a terrific panel, and having done numerous panels during COVID, I must say this is the first one that has come close to addressing a One Health lens. So I really appreciate it, and it's made me think more about, how do we turn something that's so hard to wrap your head around, like preventing epidemics and pandemics, and maybe thinking about some of the ideas that we've heard here and really engaging communities to think holistically about the way they invest, their resources, the way they, grow their food, the way, they carry on other livelihood committees, and really turn it into a positive way to reframe, healthy communities in a way that we get disease prevention to occur as a result, rather than that being the lever that takes us into a community that's just really hard for people to wrap their heads around, trying to prevent something, as unseen and until COVID, probably unfelt by many people, but certainly now we've had the experience of a pandemic that's touched the entire globe in ways that, we certainly never would have even imagined here in the United States, but has really opened up, I think, the dialogue to thinking differently. And so I think we can do it very positively by thinking about building healthier communities through a different lens than thinking about just stopping disease.
Great. Thank you so much. Obviously, there's lots of opportunities to get involved through giving, through our investments, through what we put on our plate 3 times a day. And this is more than about pangolins or turtles or tigers. This is about saving everything and everyone, and really allowing people and planet to thrive together. So thank you so much to our speakers. This has been such a wonderful and insightful conversation. And thank you so much to our audience for joining us today. Thank you. Take good care.
Thank you. Bye-bye.
Bye-bye.